Okay, so once I guess we've considered that we want to think about using one of these ambient scribe technologies in our practice, there's some really clear steps I think that practices need to consider to do, and that's both technically and practically about how we do our consultations. Tell me a bit about what practices need to do from the technical point of view before switching on and using these products in our consultation rooms.
So this has been well described. NHS England has given us some guidance. We have some North Central London guidance as well that we follow too. And the excellent team at Wilmslow Health Centre have written a dummies guide to do what you should do before you implement any AI tools. And there are regulatory issues that you need to address in terms of clinical safety. There's a data processing agreement you need to get signed off as well. And then there's a website update you need to do in terms of a privacy notice where you explain to patients exactly what's happening to their data.
Okay, so some very clear technical considerations and a process of how you think through that, all of which will be signposted to in the resources that we share with this video. Tell me a bit about whether practices need to consider having specific policies around how they use AI technologies in practice.
So anybody using the tool needs to sign an agreement in terms of how they're implementing it. They need to get consent from the patient at each consultation. It's also advised to have it advertised throughout the practice that AI tools are being used. I mean, we've seen something similar to this in terms of when you telephone up at the practice and it says calls are recorded for monitoring and training purposes. It's a similar sort of mindset you need to have, that you're using AI tools and that conversation is being recorded too.
Okay, thank you. I think we're going to go on to talk about some of the practical considerations, but for further detail on the technical implications, please do look at the resources that follow the video. Okay, so once we've decided which product we're going to use and that we want to give this a go at adopting Ambient AI Scribe in our consultation rooms, I'm guessing there's going to be some changes that we need to make as clinicians about our behaviour, our interaction with patients. I wonder, from your own experience of using it, what's been your learning from how differently you need to behave?
So I didn't know this right from the start when I started using the tool. I've been using Ambient Scribe AI for about 6 months now, and what you get trained isn't right, I don't think, so far. First of all, you should start using the tool before the patient even comes into the room. You should preload the recording with some information from the online consultation. So if there's any salient points you want to ensure is in your consultation, you pick them out. And when the patient comes into the room, you get your consent at that point. And then you can turn and face the patient, which is really refreshing, actually. And it's been a pleasure to turn and face the patient and actually really focus on them, which I know I haven't been doing for the last 10 years of practice, at least. You can really respect that golden minute a bit more, not worrying about how you have to capture on the computer. So that's changed, definitely. But then you can't think of the scribe as an intelligent device. It is ignorant. It only knows what's being said to it. So you need to make sure there's clarity in what's being said. So if the patient isn't saying something clearly, you need to echo it back just to make sure the recording captures it. You spend a lot more time summarizing than you did previously in a consultation. And I know that's part of good practice anyway. So in a way, it's forcing you to be a good doctor by summarizing the consultation each step of the way. It can't see you doing your examination, so you need to say your examination findings out loud as well. And then again, you summarize, you have to think out loud so the computer knows what you're thinking. And then you end your consultation. And when the patient leaves the room, you might continue the recording because you need to explain your management plan and your follow-up strategy to the computer so that when you finish the recording and press summary, then it's all there recorded for you.
I mean, it sounds an awful lot like how we have to behave when we're doing examinations, about being really explicit in summarising information that you've received, and also particularly, I think, those points about the examination findings. Now, there are different ways that you can set up these products to have different preferences and how you consult as an individual. So it's not the case that one size fits all. From your experience, have you tinkered or changed some of the settings to reflect the way that you practice?
Absolutely. So when I was set up into general practice mode. and there's a certain layout it has for an EMIS consultation. And that's the way you go at the beginning, but then you have to reflect on the output that it provides you. You can change the level of detail you get in your recording. What I found was that the summary was very medical and maybe didn't have enough psychosocial elements into it. So I've changed my configuration to pay special attention to those elements too, particularly if it's a mental health presentation. In my examination, I've written down certain key phrases that I tend to use in my examination so that those are listed in order. I've asked it to document the ideas, concerns and expectations explicitly in my summary. So again, that's recorded in the notes as well. And almost embarrassingly, if I haven't done the ICE in the consultation, that's missing in my summary too. So again, it's making me a better clinician.
Okay, so I mean, it's really interesting, that degree of personalization. You've spoken a bit about how the product has evolved, but also then how your consultation style has evolved. And I think what's really interesting is that we don't explicitly have training on how to use this and how to do our consultation in a way that can be documented this way. But the way that we are trained as clinicians is to do it in that way, in terms of listening, examination, formulation, and communicating a clear plan. So it's not changing what we should be doing as doctors, it's just a different way of capturing the information that comes across.